Hello, I'm Professor Shane Dark of the National Drug and Alcohol Research Centre at the University of New South Wales. Welcome to our series of lectures on drugs and the body. In this lecture we will be looking at injecting drug use. The reason we'll be doing that is because independent of any of the drugs used that are covered in this series, there are a range of diseases and conditions associated specifically with injecting as a route of administration that cross over whether people are primarily injecting opioids or methamphetamine or cocaine. Injecting in and of itself has health consequences. The consequences, I think, are quite clearly shown in the mortality rates amongst injecting drug users. The estimate is that people who are injecting drugs die at about 2% per annum. That's 15 times the population rate. Why is this the case? Well, factors such as overdose, injecting increases the risk of overdose, infectious disease. These are the two main factors, but there are a range of other health factors that contribute to this, to poorer quality of life, poorer health, and increased mortality. We'll start by looking at infectious disease. These are diseases that are primarily caused by injecting as a route of administration, but not entirely. I'm thinking here of the hepatitis. These have been highly prevalent throughout the world and have major implications for health. The major ones that we're going to look at is hepatitis B. The global prevalence of chronic infection worldwide of hepatitis B is approximately 10%. If people are infected, then about 5% of infected adults develop a chronic infection. It's spread amongst our population that we have in question here, people who inject drugs, by both the sharing of injecting equipment, that is, one person will inject a drug, pass the needle and syringe onto the next person who then injects the drug, and there is shared blood and virus. That's a major disease factor for in people who inject drugs. Hepatitis B is also spread by sexual contact as well. In that it's very different than the next virus I want to speak of is hepatitis C, which is basically spread by contaminated blood. So we're talking about needle sharing. The global prevalence of hep C is something in the order of 52%. It varies, of course, with location, but it is so highly contagious compared to hepatitis B, and that's seen in the infection rates. Chronic infection is estimated to occur in 3/4 of those infected. So this has been a major problem. It has major implications for liver disease, which we'll move on to shortly. And what we're looking at here is a disease of inflammation of the liver with the chronic effects thereof that are associated with these infections. Hep B, there is in fact a vaccine and there are antivirals. In terms of hepatitis C, in recent years we have new drugs that can cure chronic infection in over 90% of cases. In some jurisdictions these are subsidised. The implications in savings for public health are enormous if one can eliminate this disease from an infected individual, because if they're not eliminated, going on to develop serious liver disease is a major cost upon society and in the terms of the individual's welfare. And finally, human immunodeficiency virus, HIV. This is the virus that causes the disease AIDS. It is the one that causes the disease that reduces people's immunofunctioning and has been associated with mortality across the world. It varies enormously in its prevalence amongst people who inject drugs, depending where they are. Worldwide, it's estimated to be in the order of 18%, but this varies, for instance, in jurisdictions such as in parts of Australia, where we've had, since the 80s, widely available needle and syringe programs. It's been in the order of less than 1%, but we have seen it in places, for instance, like Edinburgh or New York, where over 50% of people who've used have been infected. It's spread by sexual behaviour, but it's also spread by sharing of injecting equipment. If we were doing this lecture in the 80s or 90s, we had no really effective treatments, and mortality was incredibly high. The antiviral treatments that have been available since the 90s and onwards has meant that we're looking at more at dealing with a lifelong condition rather than a death sentence. For all of these blood-borne viruses, the provision of needle and syringes to people who inject drugs, recognising that they will continue to inject drugs, we will reduce the risk of infections and the risk to the broader community of infections coming from people who inject drugs, and also the risk within that group and the cost to the individual and to society that these diseases represent. The hepatitis viruses have major effects upon the liver, as the name hepatitis indicates, inflammation of the liver. The general disease process commences with fatty liver, steatosis, chronic inflammation of the liver, steatohepatitis, as it's called. Now, this has the effect of causing scarring of the liver. The liver becomes fibrotic. The final stage of this scarring is cirrhosis, where there's extensive replacement of the liver cells by scar tissue. That in and of itself increases the risk of liver cancer. So you can see that left untreated, there's a disease process here which has major implications for the health of the individual, can result in death, and may require liver transplant. So if we can prevent this disease progression, prevent people being infected, the savings to the society are enormous, as well as the reduced human misery that is associated with these viruses. We should not, however, restrict ourselves to simply looking at viruses, although I think a great deal of public attention is given to this, particularly to HIV and to the hepatitis C virus. There are a range of soft tissue infections that come from using unsterile equipment or sharing equipment. It's not only sharing equipment that is of risk here. Having dirty needles that are carrying infection, you may not share, but you may infect yourself with some sort of potentially serious pathogen. A number of factors we see associated with such unsterile or sharing of equipment. Firstly, abscesses, candida, which is a fungal infection. This can actually, in some cases, cause permanent vision loss in some cases. Cellulitis, a potentially serious bacterial skin infection. Cavity wounds, that is sinuses, injecting cavities that present in the individual basically gaping wounds at injection sites. Infections of the vessel wall can cause what are called mycotic aneurysms, which can cause weakening of the vessel wall, which the potential of breaking of the blood vessel walls. Necrotizing fasciitis, flesh-eating disease, and blood clots, septic blood clots from infection. These are a range of diseases that I think need to be borne in mind, because when we think about the advantages of having sterile equipment, and no one, by the way, is encouraging injecting drug use, what we're talking here is about reducing the risk amongst those who do inject drugs. We shouldn't just look at the hepatitises or HIVs. We need to realise there's a range of other diseases or pathogens associated with using such equipment. So again, if we can have clean equipment used every time, the risk of these sorts of infections is substantially reduced. To date, we've looked at the infections, whether they be the hepatitises, whether they be candida, etc., that are associated with unsterile equipment. What we need to realise, however, is the sheer act of injecting can cause damage. It causes damage to the veins, and that can be very serious. So you can use clean injecting equipment every time, but holes are still being punched in the vascular system. This can result in scarring of the veins, and people constantly report they're having difficulty injecting. Injecting typically starts in the cubital fossa, that is in the crook of the arm. There tends to be a loss of injection sites, and people then may move into more dangerous sites such as the groin or the neck. There's phlebitis, that is inflammation of the veins, and this can all result in stenosis, that is blocking of the veins which are being injected into. This can all cause then ischemia, loss of oxygen to the periphery of the body, and peripheral nerve damage. There's no question that regular injecting is also associated with the development of blood clots, that is thromboemboli, and indeed with deep vein thrombosis. And finally, lymphedema, puffy hand syndrome, which is probably less frequently seen, but it comes from injecting, interfering with the lymphatic system's drainage, and causes, as the name suggested, puffy hands, and this can be present for a substantial period of time after injecting has ceased. What I've tried to get across just in this brief section is that we need to move beyond thinking of infections, and that the advantages of changing routes of administration. A regular injector of heroin, for example, who is maintained on buprenorphine, oral buprenorphine, is, while they're still opioid dependent on a prescribed opioid, the effects of injecting upon the body, both from infections and here in terms of the effects upon the veins, the vasculature, that are removed, and this is a great clinical advance in terms of an individual that has changed their route of administration from injecting to another route of administration, in this case oral. We see a similar thing with overdose, where people who smoke a drug like heroin are of substantially reduced risk of overdose compared to those who inject them. You can overdose on heroin while smoking, but again, moving from injecting to a non-injecting route of administration reduces risk. To look more specifically at an organ system, we now move on to the heart. There are two major factors in how injecting may cause problems with the person's heart. First is infective endocarditis. It comes from unsterile injecting practices or the sharing of injecting equipment. It's an infection of the endocardium, that is the inner lining of the heart, and usually involves the heart valves. And in cases of serious infection, people have had to have valve replacement operations. It's characterised by very high morbidity and mortality. It varies in its frequency around the world. Again, what we have to get across here is while injecting in and of itself causes damage, unsterile equipment is associated with a range of infections, and infective endocarditis is a particularly dangerous one. The second one I'd like to move on to is right-sided heart failure. This comes as a result of injecting crushed tablets. No matter how finely people grind tablets or try and filter them, almost all of a tablet is an insoluble bulk such as talc. The actual pharmacologically active component forms a very small part of a tablet, because if tablets just had that, they would be minuscule and difficult to use, so they're bulked out with fillers. Now, these are not soluble. They don't dissolve in the body no matter how finely you grind them, and they tend to lodge first in the pulmonary vasculature, that is the vasculature of the lungs. It's called foreign body embolization. This has real effects in terms of causing pulmonary hypertension, that is hypertension coming from the pulmonary system, and this can result in right-sided heart failure. This is not related to any one drug. It doesn't matter what tablets you're injecting, whether you're grinding up, for instance, oxycodone, an opioid, or diazepam tablets, a benzodiazepine. It is the injection of oral preparations, in this case, that is likely to cause serious health consequences. It's a particularly risky form of injecting drug use. There are also effects on the brain that we can see directly related to injecting, or more specifically to infections caused by needle sharing or unsterile equipment. Hepatitis B and C can cause cirrhosis, as we've already discussed, and this can cause coagulopathy, that is an inability to clot. This increases the risk of hemorrhagic strokes and esophageal varices. These are major clinical events that come from end-stage liver disease associated with these infections. HIV has been known since the early days, in the 80s, when it was first identified as a disease that can cause a dementia complex. This is directly associated with HIV, and the AIDS dementia complex is one potential outcome of untreated AIDS. Candida, the fungal infection we mentioned earlier, in severe cases can cause brain abscesses. This is a major clinical problem once it occurs. I mentioned infective endocarditis in relation to the heart, but it can cause aneurysm formation, ischemic stroke, and cerebral abscesses. So again, what we're seeing here is that the effects of injecting upon the body go well beyond the commonly thought of effects upon the liver or upon disease progression in terms of HIV, but have effects that these pathogens and other pathogens have spread out to other organs, in this case the brain. Finally, we should discuss the kidneys. There are two factors here, or two diseases that we need to consider. First is AA amyloidosis. This is a complication of chronic or recurrent inflammatory disease. It's caused by recurrent skin infections from unsterile equipment. It's more common amongst what are known as skin popping users, that is people who aren't injecting into a vein but are having intramuscular injections. This has serious implications if it does develop, because it can cause renal failure and death. The second factor is, again, infective endocarditis. Renal dysfunction can occur through invasion by the infective microorganism that causes the endocarditis, and through septic emboli coming out from the primary heart infection site. Again, what we're seeing here is that the effects of injecting are widespread throughout the body, and we need to keep this in mind when thinking about the health effects of injecting and the benefits of ceasing injecting. In today's lecture on injecting drug use, we've covered a wide range of issues. All of these issues are covered in the Pocket Guide to Drugs and Health. This book provides page-at-a-glance, easily digestible information that covers all of the major drug classes, all of the major organ systems, and with a chapter specifically on injecting drug use.